Hello, everyone. Welcome to this webinar from the National Collaborating Center for Methods and Tools. We are focusing today on tools, methods and tools to support evidence-informed decision-making, and we'll focus specifically on methods and tools that are appropriate for people who work in injury prevention. So welcome. I'm Susan Snelling. I'm a Senior Knowledge Translation Specialist at the National Collaborating Center for Methods and Tools, or NCCMT. I'm assisted today by Claire Howarth, and Claire will help you out if you're having any questions that you need to post in chat. She'll be helping me with polls, so thank you to Claire. Let's get going. We have a question for you first, actually, so I'll ask Claire to bring up our first poll question. Right now I'm actually looking at a screen, but I know there are people out there. So give me a sense whether it's just you calling into this webinar, or perhaps you have some colleagues with you. And I'll just give a sense here. Oh, yeah. Okay, so lots of you are solo, just like I am. A couple in small groups. One in a group of 6 to 10. Hello, everybody. That's a big group. Great. Okay, thank you. So about half of you are solo, and the rest are spread out in small groups. Thanks, everyone, for being here. Just a couple of details before we get into our content. We do mute the teleconference line during the webinar. If you have comments or questions during the webinar at any time, you can use the Q&A pod, which is on the right-hand side of your screen. You can send your questions to all. That means I will see it, everyone else will see it as well, and that can generate some useful conversation too. If you've got questions, the WebEx line is at the bottom if you're having trouble with connection, but hopefully that's not the case. If you are experiencing feedback, it can help to adjust the audio broadcast at the bottom of the panel and just move a few things around, and you'll probably be able to solve that one yourself. Now, of course, you're here, you're watching this PowerPoint presentation, but if you want to see the presentation later or have the slides for your own use, the PowerPoint will be available at our SlideShare account, and the address is there. There's also going to be an audio recording of what's happening right now. That will be on our NCCMT YouTube account. The PowerPoint is available in English and French, and the audio recording in English. So, to today's webinar. I'm going to give a very brief introduction to the National Collaborating Center for Methods and Tools. And then we're going to talk about a model for evidence-informed decision-making, and that will really be the focus of what we're going to look at today. The model may be very familiar if you've been exposed to NCCMT before. So we're looking at methods and tools for evidence-informed decision-making. And we'll talk then, as we look at that model, about steps in the process of evidence-informed public health. Now, we talk about public health because that's the field that we're most connected to at NCCMT, but if you work in other fields, this will certainly be relevant for you as well. Now, I've said that we're going to talk about evidence-informed decision-making and some methods and tools that can help you with that. Today, we're focusing on methods and tools that are relevant for injury prevention practitioners. So at the National Collaborating Center for Methods and Tools, we do a lot of training about evidence-informed decision-making, and our approach does transfer across topics. So I would almost describe it as somewhat of a generic approach that is not specific to topic. But we do have some methods and tools, and I'll be referring to them throughout the webinar that actually come from the injury prevention world. People who work in injury prevention and who are also interested in evidence have developed some tools to help people who work in injury prevention use evidence. So we'll be talking about some of those tools that are from the injury prevention world or are specifically relevant to injury prevention. And in this series of webinars, of which this is the last of 4, we thought it might make sense to focus specifically on methods and tools relevant for certain topics or certain audiences. And if you work in injury prevention, today is your day. Now, you may also have some great tools to share. So if there are tools that have really helped you to use evidence in your work in injury prevention, we'd love to hear about those. So you can use the Q&A box for that kind of sharing. I'd be interested to know what you have found helpful. And then, of course, at the end, we'll use the Q&A box for some questions for me and some dialogue that way, too. So a little bit now about the National Collaborating Center for Methods and Tools. The vision of NCCMT is that the effectiveness and efficiency of Canada's public health system will be guided by the production, sharing, and use of high-quality evidence. And so to that end, our role is to enhance evidence-informed public health practice and policy in Canada by providing leadership and expertise in supporting the uptake of what works in public health into practice. And that really is the focus of what we're going to talk about today, is figuring out a process that can guide you to interventions that work to achieve the outcomes that you have in injury prevention. I will be drawing on one of our NCCMT products called the Registry of Methods and Tools, and you can see the link there. The registry is a collection of resources that support the use of research evidence. It's free, it's searchable, it's online, and so what you'll see there is a collection of methods and tools for knowledge translation, evidence-informed practice. For each of the entries in the registry, you'll see a summary statement that describes what the method or tool is, and then a link to the actual method or tool. And as I talk about methods and tools within each of the steps of the model today, I will give you the link in the registry so that you can go to the registry, see our summary of that tool, as well as get a link to the actual tool. So if you go to the registry, this is the front page, and you can then search the registry, as it says in the sort of the middle on the left, and that will take you to the search possibilities there. Lots of good stuff in that registry, and I'm going to point you to a few of those today. So I've been talking about methods and tools, but it may help to have a little bit of a definition here in what's the difference between a method and a tool. They're certainly related. Both of them are ways that you can apply things to help you accomplish certain tasks in your evidence-informed decision-making practice or your knowledge translation practice. When I talk about a method, I'm talking about a process or a series of steps that can guide you through a certain activity. So a framework would be an example of a method. A tool is an instrument to help you carry out those steps. So a checklist, for example, is a tool. So they're very similar concepts, certainly, but a method is more process-oriented, and a tool is more operational in terms of actually how to carry out that process. So I've also been using the term evidence and evidence-informed decision-making, And particularly because we're talking about injury prevention, I want to talk about what I mean by evidence, or evidence of what. And I want to make the distinction between evidence of the problem versus evidence of effective interventions. Now, I have done work across fields in public health, including in injury prevention. And one thing I've noticed is that the injury prevention field has a lot of available data on what we might call the problem. So rates of injury, what are the causes of injury, what's the burden of injury, what are the outcomes when people have an injury, and so on. So there's actually quite a lot of data compared, let's say, to other fields in public health. And this can really help because we get an understanding of what's the nature of the problem and how big is the problem. And we can focus our efforts depending on the size of the problem and where it is. Often the data that are available about the problem can be specified by location, what's happening in my city or town, what's happening for a particular population group, for young men, for older women. You can segment the data in that way, which is not the case always for other fields of endeavor. So in injury prevention, we have, in many ways, some pretty good evidence about the problem. You can still, of course, say that, you know, there are some gaps in those data. There's more, obviously, that we would like to know. But we do have some evidence about the problem that can be specified by population group, by locale. Oops, sorry. However, what we may not, sorry, so I'm getting ahead of myself. So we have some evidence about the problem. And so I give an example here of Parachute Canada, where if you go to that excellent website, you can see reports on evidence of the problem, and there are some reports on the cost of injury. There are surveillance reports about a number of injury topics. So we're just seeing here bicycle hospitalization, alpine sport injuries, drowning, and so on. Okay. So lots of good sources out there for evidence of the problem, Parachute being one of those. However, knowing what the problem is doesn't necessarily tell us what the effective interventions are. And what I really want to focus on today is those effective interventions, and particularly what's the best available evidence of those effective interventions. So making the distinction here between evidence of the problem, which I'm not going to talk about very much, and evidence about what works. What's an effective intervention that might address that problem? So my focus here is on evidence related to intervention. And I'm just seeing a question, will there be information about how to get the presentation? Yes, at the end there will be, absolutely. So if you're wondering about where you can get the slides, I'll put that up again at the end. Now, what we have here is a model for evidence-informed decision-making in public health, although it works for other fields too. And the intent here is to say that although we are certainly interested in research, that's the bottom left circle in this Venn diagram, and that's mostly the kind of evidence that I'm going to focus on today is evidence from research. There are also other things that come into play when you're looking for evidence and wanting to make a good decision about what to do. So the research can tell you something about what might be a good decision to make, what interventions you might be interested in. But you also want to take into account other things like community health issues, what else is going on, what other concerns are happening, local context, who lives there, what are their concerns and their ways of doing things. You want to think about community and political preferences and actions. So sometimes there's just a groundswell of interest in a particular thing, or there are political windows of opportunity to take action on a particular activity. You also want to think about public health resources, and that's both in terms of people. So, do you have the staff or the skill sets that you would need to follow a certain course of action? It also, of course, comes down to money. There are some great interventions out there that we simply might not be able to afford to do. And so in that case, that limitation in funding comes into our decision making. And then also, of course, when we're making a decision, we bring our own expertise to bear, and that of our colleagues, and that of our community partners. So people have ideas and perspectives and knowledge about what's worked in the past and how to go about implementing interventions. So all of these features come into making a good decision. And it's important to talk about this because even though most of our focus will be on research evidence, that's not to say that just because the research evidence says it, that should be your decision. There are some good interventions that will not work in particular areas, or that you couldn't afford to do, or that the timing's not right, and all of those things would come into your decision. So keeping all of those things in mind, and we'll actually come back to this model a little later on as we're talking about how to adapt research evidence to the local context. So I've been talking about these terms, but again, it can be helpful just to have a definition. So evidence-informed public health is the process of distilling and disseminating the best available evidence from research and from context and from experience, and using that evidence to inform and improve public health policy and practice. So evidence-informed public health provides a systematic approach to incorporating research evidence in program and policy decisions. So we're talking about finding and using and sharing what works in our field of study. And the other piece that's important here is best available evidence. And we will talk in a little bit of detail about how to find that best available, how to zero in on what's best so that you're using that best available evidence to make your decisions. So we're interested in interventions that are effective. And there's a resource that I'll draw your attention to right away related to injury prevention. It actually came from a feature on violence prevention, but would work certainly in general for injury prevention and other topics as well. This comes from the Centers for Disease Control and Prevention, and it's called Understanding Evidence. The piece that I'm focusing on here is the best available research evidence, so just exactly the terminology that I was just talking about. And it's called, the subtitle is A Guide to the Continuum of Evidence of Effectiveness. So as we're talking about effective interventions, it can actually be helpful to think about what it is that makes an intervention what we would call effective. So this diagram is actually from that Centers for Disease Control and Prevention resource. And so they talk about this continuum of evidence of effectiveness. So this is the continuum. And the point to take here is that when you're trying to determine whether something is effective, so that's on the top of this diagram, a particular intervention can be of low effectiveness over on the right, or gradually up to very high effectiveness. In other words, it produces the desired outcome. We also want to think about whether it's producing non-desirable outcomes, and if that's the case, then it would fall into that harmful category, which is in the bar right over at the right, because as we're implementing interventions, of course, we do not want to be causing harm. So we think about effectiveness as, is it good at producing the desired outcomes? But we also want to think about the strength of the evidence. And that's along the left side going up, so from weak to strong, and can be anywhere in there. And strength of evidence brings into our discussion that the program or course of action has been evaluated, and that the evidence is strong or not strong in producing the desired outcomes. So what we're thinking about when we put these together, the strength of the evidence and the effectiveness, is that we really want to be sure that our evidence that we're using, the best available, kind of comes together in that top left corner. So we're looking for interventions that are very effective, highly effective, but also where the strength of the evidence is strong. So sometimes what you'll see, especially in a new field, is that there may be a few studies coming out. They're not very well done studies, so the strength of the evidence would be weak, but they seem to show that something is really promising, that is, that it's effective. What we're interested in, though, is effective interventions that are well supported, where the evidence is strong. We don't always have that. We're not always fortunate enough to be asking a certain question and then being able to find good, strong evidence for that. And so when we're talking about best available, we recognize that sometimes the evidence can only support or maybe be considered promising or just emerging. And if that's the best available, we work with that. So we're not intending to be rigid here that the effectiveness has to be super high and the strength has to be super high, because that's not always the case. However, we do want to move along this continuum as far as we can toward those highly effective and strongly supported by evidence interventions. So I'm going to now talk about this process of evidence-informed public health, and this really will form the basis of the rest of the webinar, to look at these steps and methods and tools that can support you in using an evidence-informed approach to the work that you do in injury prevention. So there are 7 steps, and we'll start with define, although it's actually possible to start anywhere. I've created a scenario just to walk through kind of as an example as we go through here. So let's say that your intent is to do some work in falls prevention for seniors living at home, and perhaps there's an opportunity to offer some programming in partnership with several stakeholders. So sometimes things just come up, right? There's a funding stream, or someone contacts you to say, hey, could we do something together? And so sometimes this context leads you to ask the question about, what is it that works for this particular issue? So in this case, what is it that works for falls prevention for seniors who are living in their own homes? So our question here is, how can the steps of evidence-informed public health be applied to this scenario? And that's what we're going to walk through. Now, I'll give you fair warning here that this webinar is not about the findings of the evidence that work in this area. So If you have a question about, what is the most effective approach for falls prevention for seniors living at home, you will not know the answer to that question by the end of this webinar. What you will know, though, is a process so that you can find and appraise and use the evidence yourself to answer that question or another question. So our focus here is on the process rather than the content, but I certainly will make reference to this example just to show you how this may work in this field of injury prevention. So we're going to start with define, but as I said, it's a wheel, so you can start anywhere. If you're starting brand new to a question, often we start with defining what the question or problem is that we would actually be interested in. So as I said, in injury prevention, we actually often have a fair bit of information about what the problem is, and so that can help us to focus in on what is the problem then that we're trying to solve with our intervention. When you're in this define stage, a framework can really help, and that's particularly true if a framework is evidence-informed or based on evidence to start with, as this one is. So this is the Beach model of categories and settings of intervention that are specific to falls prevention. This model is it comes from the Canadian Falls Prevention Curriculum, so if you're interested in more, check out the Canadian Falls Prevention Curriculum. I'm bringing this up here because it helps us when we're in this define stage to actually think about some of those factors that we already know may be helpful in preventing falls. And so the intent of this model here is that if we're after behavior change, we want to think about all of these aspects or ways that we could intervene: education, equipment, changes to the environment, activity patterns, clothing and footwear, health management. All of those things can have an influence on or result in behavior change. So that gives us some sense of how we might define a research question or search for research evidence. Also in the bottom of this model, the settings are defined. So we might be thinking about an intervention that's in the home or in the community or in the hospital or a residential setting. Now, as I said in the scenario that we're working on, I've said that we'd be interested in working or looking at interventions that would address the needs of seniors living at home. Okay, so we're not talking about hospital settings, for example. Okay, so a model, as in this one, can help us to broaden our thinking in terms of, what research evidence should we be looking at? And it can also help us to narrow our focus. So in this case, we're saying, okay, we're not interested in hospital setting. Might be residential. Certainly, though, would be home, perhaps in community. So let's move on then to look at a structure that can help you to define the question. So we call this Pico, and pretty much in any question, anytime you're searching for evidence, you can define your question in terms of these factors. What's the population of interest? What type of intervention are you interested in? What's the comparison group? And what's the outcome of interest? We also sometimes talk about PS if it's a qualitative question, so if we're looking for more evidence related to people's experience of something. And PS stands for population and situation. But in this case, we would be interested in quantitative evidence, certainly, so we'll go with Pico. So if we were using this framework in our scenario, the population, we've already said, is community-dwelling seniors, so people who live in their own homes. And we could, I'm sure you are already thinking, we could get even more specific here. So by seniors, do we mean over 55? Do we mean over 65? Sometimes we would define an elderly group as over 75. So we could get progressively more specific, but for the time being, we'll define it as community dwelling seniors. The intervention, in this case, we're going to leave that unspecified for our scenario. And I'm saying this partly to say sometimes you don't know, you can't define it. And we haven't made any decision about what kind of intervention we want to implement. You know, is it an assessment and screening intervention? Is it a treatment intervention? What is it? We don't have any parameters around that. So we won't specify that in our question. Our comparison would be, we want our intervention to be better than nothing, so better than no intervention, or better than usual care, what already happens, which in this case might in fact be nothing. The outcome that we're interested in, I'll say here, is prevention of falls. But if you work in this area, you'll know that sometimes the outcome might not exactly be prevention of falls, but prevention of repeated falls or prevention of falls that result in hospitalization. So you can, again, get more specific about the outcome or about really any of these variables. When I'm helping people to define their question before they go and look for evidence, I tend to suggest that you keep it fairly broad. You can always narrow it, and I'll actually show you a little bit about how to do that in some of the databases that we'll search. But it's generally better to start broad, and if you get too many hits, you can always narrow. So there's kind of an iterative process between defining and searching, as we'll see. So we'll stick with this for now, and if we needed to be more specific to really zero in on what we wanted, we could always come back. Now I have a tool to recommend for this define stage, and this tool is called Developing an Efficient Search Strategy Using Pico. So exactly what we've been talking about. It's how to define that evidence search question using the Pico format. The link is here, and as I said, these links will take you to the NCCMT Registry, where you can read a summary of this tool, as well as go to the link for the actual tool. The actual tool looks like this, and it comes to us from our friends at Health Evidence. And you'll see Pico right across the top there, population intervention, or sometimes it's called exposure, comparison and outcomes. And it's really just a table. It's a form that helps you to structure your question. So if you're not quite sure what you should be saying about the population, there are some examples or prompts there. Now, it does suggest that you're coming from a clinical question. That's just a specific of this tool, but it would certainly work in applied context as well, in community context. So don't be thrown off by the fact that it's looking for a clinical question. We can really work with any kind of question related to health and well-being using this Pico format. So this tool may be just something that can help you provide some structure for your search question, which is what we're doing in this define stage. Now we move on around the wheel to the search step. And in the search step, we're efficiently searching for research evidence. Now, of course, it's the search step, so you would expect that it was something about searching. And you already know that I'm talking about research evidence. The new thing here is about being efficient, and I'm really going to emphasize that in my discussion about what happens in this stage. And I would say probably everyone is interested in efficiency, but I think it's particularly true for people who work in public and community health, because this isn't your only thing that you're doing. It's not like you spend your time searching for evidence all day or all week or all month. There are people who do that, but it's probably not you. So you need to be really efficient in your search for evidence so that you get to that best available evidence as fast as you can so that you can get on to actually implementing the intervention. So one way of helping to get to the most high quality evidence as fast as you can is to think about a search pyramid, and there are some examples of this, again, through the NC CMT website. These pyramids, and I'll show you a picture of it in a second, the pyramids are pre-populated with good sites, databases, and so on for finding evidence in public health and related fields, and they're specific for topics. And injury prevention is one of those topics. So for the pyramids, there are other pyramids that focus on where to search for evidence for mental health, for health communication, for environmental health, for healthy habits for adults and for children, some general sites in public health. But of course, we're talking about injury prevention, so I'm going to focus today on the injury prevention pyramid. And we want to start at the top in our quest for efficiency so that we're looking at the most synthesized evidence. This saves us time, and it ensures that we're being systematic in our searching. So here's what it looks like. The injury prevention 6S pyramid. You can probably figure out by looking at it why it's called 6S, 6 steps, all starting with S. And what you'll see is if we start at the top, we're looking for evidence that is highly synthesized. That is, someone else has done the work for you. This saves you time. And it's also efficient because you know that everything that you should be looking at has been pulled together in those systems or summaries. So right at the top of the pyramid. Now, in public health and community health, we don't often have things that we could call a system. So a system would be like in clinical medicine, we might start to see evidence of research evidence being brought together with clinical history evidence from your electronic medical record, and this would all kind of be brought together and come out with a specific course of treatment. Okay, that would be like a system. We don't have that in public health. It's just not the nature of the evidence that we have. But we do have sources for summaries. So I'm moving slightly down the pyramid, but still to a level that has very synthesized evidence. So what we are calling a summary is something like a guideline, a best practice document. And if you're looking for that kind of best practice document and so on, the pyramid gives you some sources for that. So right at the top is the National Guideline Clearinghouse, and I'm actually going to show you that one in a minute. So the National Guideline Clearinghouse has all sorts of practice guidelines, and you can search it and get pretty specific about what you're looking for. NICE, the National Institute for Health and Care Excellence, comes from the UK, and again, there are some pretty good guidance documents there. Now, you'll see on the screen that those are above that big orange warning sign, and that's because those sites are pre-appraised for quality. And so we're not only interested in efficiency, that is, finding it quickly, we also want the best available. We are interested in that good quality evidence. So pre-appraised is even faster for you because you know you're getting guidelines that have passed some sort of quality appraisal. They were done well, they included the right information, they had a systematic process for what ended up in their guideline. Below that orange line in the pyramid, you will see other ways that you can find summaries, and the warning is just there to say they haven't been pre-appraised. And that just means you have to do it yourself. It doesn't mean that they're not good. They could be equally good, maybe even better than what you'll find in those pre-appraised sources. It's just that appraisal isn't a step that these particular databases take. So let's take a look at the National Guideline Clearinghouse. And I'm going to take you to the advanced search, which is, it gives you a little more specificity. And so thinking back to our Pico, I know that I'm interested in falls prevention, and you can't see the whole thing that I've typed in there, but I was looking for falls prevention and community. So I know that my population is community. The other thing that I'm going to check off here is aged. So we're getting the other part of our population. This is how you can check off seniors. So I could have put in seniors as a keyword up top, but it's actually probably more specific to use their checkoff menus where they exist. And the other thing just to know about this site is if you check off filter by, as I have done here, guidelines that meet the National Guideline Clearinghouse inclusion criteria, that's their appraisal process. So you'll get better quality guidelines by searching with that checked off. So if I run this search looking for falls prevention and community among aged population, and you can see those specified at the top there, what comes up, I get 28 hits. And the specifics here are not super important. I just want to show you how this database works. Now, from my perspective, 28 is probably a nice number because you could go through 28, you know, just looking at the titles there. Probably some of these wouldn't be really relevant for you. So, for example, the first one is screening for vitamin D deficiency in adults. So maybe you already know that's not something that you're going to be able to do, or it doesn't align with what else is going on in the community or whatever. So you wouldn't be interested in that one. The next one is screening for cognitive impairment in older adults, and you can decide whether that might be a relevant approach. So fairly quickly just going through these titles to see what's there, and then you can follow their link and go to the actual source. So the National Guideline Clearinghouse is one good source for those summary kinds of things that are at the top of the pyramid. And I'd encourage you, if you're interested, to poke around on that site more and get used to how you can search. Now, sometimes, though, you know, we find a best practice document that was at that summary level, and it tells us everything that we need to know. It brings together all the interventions. It seems relevant for our context. It's the right population. And sometimes that's it. Your search is done because you fulfilled all the criteria for a good search from an evidence-informed practice perspective. You've gone to look for the best available evidence. And when you're looking for a summary, a best practice document, for example, that's been well done, of good quality, that has brought together all the evidence that you may need. But sometimes you don't find something that's really quite on target, doesn't quite tell you what you're looking for or doesn't give you the level of detail that you're looking for to really be able to implement an intervention or make a good decision about what intervention to implement. If that's the case, that you don't find anything quite on target under summaries, you move a little bit down the pyramid. So I'll take that middle cluster, synopses of syntheses and syntheses, and show you what the pyramid suggests in terms of the databases that you can go to. So healthevidence.org is a really good source for syntheses, and here what we're talking about is systematic reviews, meta-analyses. These are the kinds of sources that bring together single research studies in a systematic way and give you kind of an overview or a synthesis of what we know about the evidence in that field. Again, this is efficient because then you don't have to go and look at all those single studies because someone's done it for you. So the day that you find a good quality systematic review that's on topic and relevant for you is a happy day because it really means that you can get on to the work of making your decision and implementing your intervention. So healthevidence.org is one site. Public Health Plus is another one that you can get to through NCCMT.ca. The Guide to Community Preventive Services is US-based source of syntheses specifically for community health topics and prevention, so certainly very relevant for people who work in injury prevention. And if you were looking at this pyramid live, you could scroll down and see other sources below that warning bar that may be equally good. It's just that they haven't been pre-appraised, so you would have to do the appraisal. So I'll give you a look at what we might find on healthevidence.org. Here's the front page here, and as we noted, Health Evidence is going to be a source for systematic reviews, meta-analyses. So if we search, I'll suggest that you do an advanced search because it gives you more specificity. And there are drop-down menus, so as you can see with the little green box, you can select by topic area. So we're going to select here for the topic of injury prevention and safety. And if I do just that and specify nothing else beyond injury prevention and safety, I get 498 results. Now, that doesn't make me happy because there's no way that I can systematically go through close to 500 systematic reviews and really make any sense of it. It's just too much. So it's at this point that I would narrow my search to try to get that number down so that I'm still getting things on target, but leaving out some things that perhaps are not relevant for what I want to know. So I'll go back then and specify not only injury prevention and safety, but also specify the population. So I can specify seniors here defined as 60+ years. And if I specify those two things, I get 133 results. So that's bringing the number down. And what you can see here is that by kind of cycling through your search a number of times, you can narrow the number of results so that you're still getting everything that you want to see, but not including so much that you can't possibly get through it all. So 133 is still kind of a lot. So we're getting down, but I probably wouldn't stop there. We've been able to specify injury prevention, but we haven't specified falls. So that's what I would do next. At the top, I can type in the keyword falls and still be specifying injury prevention and safety, still be specifying the population as seniors. And I'll also choose the setting. Here I have some options, but I've chosen community. Okay, so getting gradually more specific, and let's see what I get now with those search terms. 54 results. We could still even cut down more, but I'm going to stop here because I'm sure you get the idea. One way, though, if you were to want to narrow it even more, might be to cut down based on the quality of the review. So what we have in health evidence along the right side of the display that you're seeing is the rating. And it's rated here. The 3 green bars mean it's of strong quality. But you'll see the third one there just at the bottom of the page is of moderate quality. And if we're getting 54 results, that means we've got some room to move, shall I say. You know, we could cut this down even more. So I might be inclined to say, don't show me those results of systematic reviews that weren't done very well. I want the best available. And so one way that you could do that would be to select only for strong ratings of the quality. And that's a rating of the quality of the systematic review. Did they do the review in a good way? It's not a rating of how strong the evidence is. Okay? It's a quality rating. So that would be another way that I might want to reduce that 54 to something even less than that and more on target. So just knowing the scenario that I'm working with or the topic, the second one here really looks interesting to me, and there will probably be others among those 54 that would be interesting. So this one is called What Works to Prevent Falls in Community-Dwelling Older Adults. It's an umbrella review of meta-analyses of randomized control trials. Even if you don't know what that means, the first part of that sentence is really on target with what we're looking at. So that would definitely be a review that I would want to see. And if you click on those links, it will take you to a write-up about that, and we'll give you the reference and the link to the actual article. So I'm not going to do that just yet, but keep in mind that we do have at least one systematic review that we would take forward and use in our decision-making process. Now, sometimes, I wouldn't say it in this particular case, but sometimes we don't find what we're looking for at the summary level or the synthesis level. And at that point, we do need then to go to single studies. But please don't feel that if you're not looking at the single studies, you haven't been thorough. The syntheses may have done that for you. The summaries may have done that for you. And if that is the case, you're perfectly on solid ground to stop once you've found a good synthesis, or maybe more than one. You don't always have to go to the single studies in order to do a good job of evidence-informed decision-making. But under some conditions, if you're looking for a particular population, so seniors of South Asian ancestry, for example, if that's a population that you know you're working with, there may be some specific features of working with that population that you would want to know about. And maybe there's no review or synthesis on that. So it's then that you would need to go to the studies level in the pyramid. So some good sources for single studies in health. PubMed is always the one that people tend to go to first, and that can be a good one. You'll get a lot on PubMed, so you really need to know how to do some good searching there to get it down to a level that's manageable for you. Public Health Plus is also a source for studies. The Canadian Best Practices portal is also on the list, and you can find some good sources there of examples that people have actually implemented in Canada. So that can be very relevant. Of course, those are not appraised for quality, so you have to do that. Doesn't mean they're not good, just that you have to check. As you're getting down the pyramid, you're getting more and more volume. So you're going to get more single studies than you will find syntheses. And this is important to keep in mind because you need to keep a systematic approach. You can't just pick out a few studies out of the 6,000 that you might find and say, oh yeah, I did it. Because we really want to be sure that we're covering all the bases and being systematic in our search. If you're not systematic, you're introducing bias. You pick this one and not that one without any clear reason for that. And that's what the tabloids do, right? They pick out one thing, they ignore the other thing. That's not evidence-informed decision-making. So if you're going to single studies, you need to be prepared then to look at all the studies that you find. And it's not the most efficient approach, but sometimes you need to go there. So as you're searching, go for the highest possible level on the pyramid, go for those pre-appraised sources so that you don't have to take the time to do the appraisal and you're sure that you're getting good quality and that best available. If you want to know more about searching, there's an online module through NC CMT that may be of interest for you. The next step around the wheel is appraise. So here we want to critically and efficiently appraise the research methods in that evidence that we found. Now, I was just talking about some sites that are pre-appraised. So sometimes you get lucky and someone has done this work for you. But if that's not the case, or you would just want to be extra sure that it meets your standards for appraisal, there are some recommended tools, and I've got the links here. And the tool that you would use depends on the type of evidence that you are looking at. So the Agree To instrument is intended for appraising practice guidelines, best practice documents, and it will look at the way that that practice guideline was put together. Did they follow a good process? If you're looking at systematic reviews, the AmStar tool is one that I can recommend. Asks the right questions about how this systematic review was done, what was included, what was excluded, and so on. And then if you're looking at single studies, the Critical Appraisal Skills Program, or CASP, has checklists for different kinds of research design. So qualitative studies, randomized control trials. There are 8 different checklists for different kinds of studies. So that appraisal step is an important one to do. Maybe someone else has done it for you, which is great, or maybe you'll need to do it yourself. And the tools can help you. When you're appraising, you're filtering and looking for sources of bias in the evidence. You're asking the question, is this research or this review or this practice guideline of good enough quality that I should read further? And sometimes the answer is no. Sometimes you'll find something and do the appraisal and say, this was so badly done, I'm not even going to waste my time reading it. Again, some of the things you'll find in the tabloids, not even worth your time to read. Now, as we're being critical and doing critical appraisal, it's important to note that all research has flaws. You're not likely to find the really perfect review or the really perfect study, but some flaws are more serious than others. And that's what these tools can help you do, is to say, okay, in the scheme of things, how bad is it? How well or badly done was this research? And can I trust it? Because I'm going to be making a decision based on what it says. So I want it to be trustworthy. That's the kind of questions that we're looking at in Appraise. We have an online learning module for this as well at NCCMT, and if you're really interested in evidence-informed decision-making, and particularly in appraisal, there's a week-long course at McMaster University. It's offered every May, so you just missed it, but you could plan ahead for 11 months and be there next year. The next step around our wheel is synthesize. And at this step, we have collected all of our information. We've defined our question, we've searched, we've appraised it, and now we have all of it and we need to pull it together. What does it mean? What is it telling us? What decisions might it lead us to? And how do we deal with those darn conflicting results? And this is a concern that people often have when they're pulling together evidence from multiple sources. One thing says one thing, one source says another thing. You know, if you listen to the radio in the morning, often they'll say, oh, you know, today chocolate is good for you, but, you know, yesterday we were saying chocolate is bad for you. You can't believe any of it. Well, that's not quite true. You actually can believe some of it, and of course, you know where I'm going with this. You can believe the stuff that is of good quality, and that's what we're looking for. So when we're synthesizing, often there's a tool here for synthesizing for a briefing note. And you may have your own template for a briefing note, but if you don't have one, here's one. And we're gradually now working toward our decision. We found the evidence. What is it telling us? And it may not be you that's making a decision. You may be briefing up, as they say, informing the decision makers in your organization about what you found and what action should be considered based on the evidence. So in that systematic review that we found in health evidence, this might be one of the sources that you're trying to bring together. So here are some key findings from Stubbs, that is systematic review. Exercise reduces falls, and I've put the data in there because it's important to know not only how effective an intervention is, but also how strong the evidence is. Remember that continuum that we saw from the Centers for Disease Prevention and Control. So we want to know, okay, what's the effectiveness? Exercise is effective, and how strong is that evidence? In this case, pretty effective. We also see from Stubbs that multifactorial interventions reduce fall. Okay, so there's another thing to consider. Exercise is good. Multifactorial, meaning more than one thing going on, more than one factor in the intervention. And there's conflicting evidence regarding vitamin D supplementation. So, you know, just over 50% reported a reduction, others didn't. So, okay, we've got some findings. We would want to synthesize those. And if you're using a briefing note, this would be the kind of interventions that you might be describing. I'm presenting a simplified case here because you probably would have more than one source. This is just what we found from one systematic review, but there may be others that you would bring in as well and try to synthesize at this stage. Back to our framework, because that can help to kind of organize what we're finding, what we're talking about. It can help for making decisions as well to kind of balance out where we're seeing the greatest effectiveness and where maybe the evidence is a little bit less. So for example, health management might be the area where we would be looking at vitamin D supplementation, but the evidence is kind of so-so on that one. So in this particular case, that might not be the biggest part of our intervention, but there might be other pieces related to activity, for example, because we know that exercise makes a difference, And this idea of being multifactorial, so bringing in other things as well, we know may be helpful. So frameworks can be helpful at the defining stage, but also really helpful to use at the synthesizing stage. The briefing note tool that I was talking about looks like this, and it really just gives you some prompts and boxes and things to check off, some structure for a briefing note. So that can be helpful if you're trying to summarize a big mountain of evidence that you may have found. In the synthesize step, we're bringing good quality evidence together to determine results and implications. So what does it tell us, and what does it mean for the decision that we might make? If the results conflict, look at those conflicting sources and see which is the highest quality. That is, was the research well done or not? Prefer sources that are most recent, and of course things that are most relevant to your question. Sorry, a little coughing there. Because we're interested in actually doing something, implementing an intervention, we want to look for things that would actually guide our actions. So that's something that we would certainly want to bring into our briefing note or other method for synthesizing. We now move around the wheel to adapting, and here we're saying, okay, it worked in the, the research evidence, wherever that came from, or maybe it was from multiple sources. Will it work here? Will it work with our population? Will it work in our local community? And it's at this point that we come back to that model that I introduced at the beginning, because the research evidence can only take us so far when we're trying to adapt to the local community. So particularly helpful to say, at this point, here's what the research says, and we've synthesized that in our previous step. But we can also bring in the local context. What's already happening? Maybe someone else is already offering a similar program, so we wouldn't have to do it. Maybe there's a gap, and we should really focus on filling that gap. Maybe there's a window of political opportunity, and now the time is right. Or, if you were thinking about injury prevention, it's summer now, so you might say now's the time for an intervention related to drowning, related to activities on and around the water. So timing can be important as well. Okay, so all these decisions about what's going to work here, what's acceptable to people here, can we afford it, all of that comes into our decision. And some tools to help you do that, there's one that's called It Worked There, Will It Work Here? And this is a tool that really just walks you through some steps, some questions to ask about, we have our evidence, how applicable is it for our setting? How much will these findings transfer to, so that we can expect similar findings in our own community? The second tool, is this evidence useful to me, is actually based on the first tool, but it has some additional content related to health equity. So if you're working with a vulnerable population or a marginalized population, or that's a particular angle for what you're doing, the second tool, is this evidence useful to me, may prompt you with some questions to really think about the equity implications of what you might do in your local community. There's an online learning module related to this step as well, so how to assess the applicability and transferability of evidence in this ADAPT step. So if that's of interest to you, please check that out. And when you're thinking about this ADAPT step, you want to think about the research evidence, what stakeholders think and want to do, what's going on in the community. Maybe there's a hot issue right now that deserves some attention, the political context, your data reports. So, you know, this is a big problem in some places, but is it a big problem here? If you don't have a lot of water sources around, maybe you don't need to worry about boating safety in your community. Where I live, it's an island, so we have lots of boating, and so that might be really appropriate. Financial and human resources can come into your decisions as well. So the overall question is, we found some interventions that seem to work. Will they be appropriate for our community? Now we're getting around the wheel, and the next step is implement. So as we're taking an evidence-informed approach to public health, we need to give some attention to how to implement that intervention, that change in practice or policy. Change doesn't just happen, as I'm sure you know, so you have to give some thought to how you would get people on board, get everyone involved. And one of the things to think about at this step is how to communicate evidence to your partners and community members. Now, if you work in public health, I know that often people around a multi-sector table, the people from public health often are bringing the evidence to that table. Sometimes we have more access to data and evidence than other community groups and so on. So if you're in a role of communicating evidence to partners and community members, you want to be thinking about how can I really communicate what the evidence says so that it will be helpful for the group to make a good decision. So you might think about which of these is more likely to meet the need. This is actually the study or the summary of STUBS, that systematic review that we saw. This is just the abstract. And if you're pulling that evidence, you should be reading this. So it's not to say that this kind of abstract and the whole review is not good. It is good, and it will give you lots of detail and evidence that you should have if you're in that role of bringing evidence forward. However, if you're working with community groups who might be put off by some of the technical language, you might then want to look for other sources. And I just bring one forward here that might be of interest for people who are working with seniors populations. So the McMaster Optimal Aging Portal has lots of information for community members as well as professionals. It's evidence-based, so it's translating knowledge for a community population. So here you can find some evidence about falls and injury prevention. And, you know, people can follow a little more along to get more evidence. But that kind of source, that kind of translation of the knowledge might be what's really important to getting people familiar with the evidence so that they could make good evidence-informed decisions. So just thinking about the way that evidence is presented doesn't mean that you're moving away from the evidence, but presentation can be really important to getting people on board. So there's the site for the Optimal Aging Portal. Another tool that I can recommend to you when you're thinking about implementation is this one from the Canadian Public Health Association. It's called A Tool for Strengthening Chronic Disease Prevention and Management through dialogue, planning, and assessment. So of course here, specifically intended for chronic disease prevention, but would be very relevant for people working in injury prevention as well. This resource it's good for a number of steps, but I bring it forward at implementation because it's very good for stakeholder engagement, and there are case studies and worksheets, very practical kind of hands-on approach to lots of things, including how to engage with stakeholders. And injury prevention is really, I would say, exemplary in the way that the work is done in coalitions, in community groups coming together. And so you need to figure out how to implement an intervention together with multiple stakeholders. It's a challenge, but it's also a great opportunity, and this tool may be able to help. Now, we're around to evaluate on our wheel. And in evaluating, we're interested in the effectiveness of the change on practice or policy. So did the intervention that we wanted to put in place actually make the change that we were looking for? We can also be evaluating here our own process. So we want to think about whether we were effective at doing evidence-informed decision-making. Were we effective at finding and using and applying the best available research evidence? If we're trying to move from an evidence-informed public health approach, it can be helpful to just reflect on that a little bit. So there are lots of tools out there for how to do evaluation of interventions, so I'm actually not going to talk about those ones, although you can find some of those on the registry. But the tool that I am going to recommend is one of those reflective practice kind of tools. It can guide you in how effective you were in using evidence in making your decisions. So the tool is called Improving Future Decisions, Optimizing the Decision Process from Lessons Learned. Looks like this. Looks similar to the other ones because it comes to us from our colleagues at Health Evidence. And so it really links to the previous work that you've done. So you'll see the place for the briefing note number if you use that. But the intent is to link back to what did you find in your evidence? How did you bring that forward? And then in this step, what was the decision process? What was supposed to happen? You know, were people supposed to start doing a new practice? Did that actually happen? Sometimes the best laid plans don't always turn out the way we expect. So this is where the lessons learned come into it, is we can bring forward research evidence, but remember that Venn diagram. It's not only the research evidence that comes into our decision making, it's other things too. So we need to reflect on how we can help ourselves the next time around to be effective in our use of evidence. So lots of prompting questions here to help you think about and be reflective about the decisions that you make in your practice. So as you're evaluating, you're thinking about describing your process and then reflecting on it. And it may seem kind of like an extra step. You know, we want to just get on with doing our work and our interventions and working with partners. But to have a written reflection every so often about what worked and what didn't, even if it's very simple, just that one form, can really help when 2 or 3 years down the road you're thinking about doing something similar and everybody's moved on to different jobs and you want to go back and look at some of the documentation. It can be really helpful to have this kind of reflective practice documentation. So that was a quick trip through these seven steps with methods and tools to help you do them. and a focus on injury prevention methods and tools where they exist. So I'd love to hear your questions or your comments. You can put those in the Q&A box, so I'll give you some time to start writing your questions and comments, but we have a poll question for you. The methods and tools that I described today, how familiar are you with those? Have you, are they all new to you? Have you heard of some of them? Have you perhaps used some of those? And if you have used them, share your experience in the Q&A box, because I'd really like to know how these work for you in practice. Okay, so about half of you have heard or of one or more of the methods and tools, so that's great. A few of you have actually used one of them, so about 10% have done so. So that's great. Well, let's hear from you. I'd be interested to know how that worked for you. And if you're trying to approach a decision from an evidence-informed perspective, this is a checklist that I'll just draw to your attention because it summarizes really quickly some of those steps and the tools that you can use at each of those steps in our 7-step process. So if you're looking for a really quick reference point, this is it. And you can find that in the registry at our website. Now, another question for you, and again, we'll go to questions in just a moment. To what extent do you think the methods or tools that we described today will be useful for you? Certainly hoping that they will and that you learned something or were reminded of something that will be helpful to you. Okay, great. So results coming in. So about half are saying very useful and somewhat useful as well, about 20%, so that's terrific. Results still coming in. Great, well, I hope that's the case, and we're certainly always interested to hear about your experience with using the tools. So at the very end, there's an email address that just goes to NCCMT, but we really are always interested to hear your experience with using the tools, any questions that you have about them. So let us know now or later if you have experiences to share. So happy to take some questions or have some discussions. You can use the Q&A box for that purpose, and you can send your questions to everyone so that we can all see them. I did notice a question earlier on just about, this was in chat. So someone who had to leave early and is saying, what's the best website to look for evidence? I'm often using Cochrane and SumSearch too. Where else should I go to look for evidence? So that person didn't see the injury prevention pyramid, but that's what I would suggest is start at the top there with some of those sources and move your way down. If you're using Cochrane, that's great. So Cochrane does very high quality systematic reviews. You will find the Cochrane reviews all come up on Health Evidence, plus other systematic reviews besides Cochrane. So if you're used to using systematic reviews, Health Evidence can be a good source. So now another question has come in. From a workplace health and safety perspective, what kinds of tools do you recommend for researchers to use to find syntheses of evidence-based interventions, but really from a workplace perspective? Yes, so this is a question of getting sort of more and more specific. So Health Evidence will still have a fair bit of information about evidence-based interventions for workplace context, so I would suggest health evidence. You'll find a lot of workplace-focused things on the National Guidelines Clearinghouse as well. And what I would suggest is if you find a guideline from a good source, like a professional organization related to workplace health, for example, the National Guidelines Clearinghouse site allows you to search for other guidelines from that same source. So that, like, once you find one that's good, you might want to look for others from that association. And so if you're working in particular areas, often once you've done a perhaps more generic search, I do suggest that you go to professional organizations or associations. The onus is on you, though, to be sure that you're doing the quality appraisal. So if any site is putting out an evidence brief that's a best practice document, for example, well, ask yourself or interrogate that document and say, well, how did they come up with that? What was included? What did they exclude? What was their search strategy? Did everything that should be in there make it in? You know, all of those questions are really important to ask at that appraisal step. And if that appraisal hasn't been done, you need to be doing that. So thanks for that question. And maybe there are others on the line who have some good workplace sources as well. So I have another poll question for you to just see what are your next steps. What do you think you might do? So are there methods or tools that were referenced here that you might go and look at? Maybe you'll read one of our summaries about the method or tool or consider using one of them in practice. Maybe there's something here that you want to share with a colleague, and that's always great word of mouth as well. So, oh, wow, look at that. Lots of people saying they're going to access a method or tool. Fantastic. Hope that's successful for you, and consider using those tools in practice. Yeah, wonderful. As I said, let us know how that goes for you. Even if it doesn't work so well, we're always interested in your experience. So I think there was a question about where the presentation can be found. If you want to look for the slides will be available in French and English. The audio recording is available in English, and so here are the links again. It's at our SlideShare account, so slideshare.net, NC CMT. Couldn't be easier. And so, yes, if you're interested in seeing those slides and those links, please do follow up with that. So, some other questions. During the synthesize step, you talked about guiding our action. Can you please give an example of this? How is this different than adapt, which is the next step? So in synthesize, particularly when we're doing this kind of decision making that that's going to result in doing something, we want to look to the evidence when we're synthesizing and say, not only what does the evidence tell us, so exercise helps to reduce falls as one finding, but what does that mean for what we should do? So, so guiding our action might be as simple as saying we should consider programs that introduce safe exercise for the seniors population. Okay? So it's stretching out those findings from the research to the action, which is really what knowledge translation is all about. So the research says something, but what would it mean for our context? If you work in public health, we often try to look for, does this align with our role, or is there somewhere else in the community who should be doing this? So there may be some really good research evidence that it's not our role to act on those, but maybe someone else could. So maybe our role would be to advocate for this or to partner with someone else. So that's where the actions take into account what's our role, what's our mandate, what have we tried before, all of those kinds of moving to the next step. Now, the difference between that and adapt is adapting is really looking at that local experience. So they definitely do blend, but the guiding the action can really be, if this evidence says this, what would that mean? And then we would still kind of run that through a filter of, could we do it? Would people tolerate it? And so on. Okay, would it be acceptable here? Okay. So we're almost coming up to the end. So just want to invite you to share your thoughts on today's webinar. When you close this, you'll see the link, but there's also the link there. We do look at that feedback and we value it, so thank you for any thoughts that you have to share that would help us do even better next time we share some information. And here's our website, and here's that contact information. So if you have other questions or you want to share some experiences, nccmt@mcmaster.ca. Thanks so much for participating today, and happy evidence-informed decision-making.